Welcome to the tutorial, Adding a Recommendation. This tutorial is the third in a series regarding working with recommendations during the patient intake. If you have not completed the tutorials, Updating Recommendations during the Patient Visit and Managing Recommendations, please make a point to complete them before proceeding on with this tutorial. As you learned earlier, you will use the Recommendations section of the patient chart to update and manage a patient's preventative needs by satisfying recommendations in a timely manner. We will use patient reminders to generate letters to patients for health maintenance items that are approaching their due date or that are past due. These reminders will serve to meet Meaningful Use Stage 2, Measure 12. In this tutorial, you will learn how to manually add a recommendation to a patient chart. Currently, the recommendations that display on a patient's chart are based on USPTF recommendations for adult patients. However, there may be items you want to monitor for particular adult patients or children. From the Recommendations section of the chart, click the Add button located in the top right corner of the window. An ad hoc dialog window displays. The Name tab defaults and displays a folder structure for recommendation types. Expanding an item will display the specific recommendation you may assign to a patient. For example, the patient record you are currently looking at is for an asthmatic child. Since there are no default recommendations for asthmatic children, you want to add spirometry. To start, you need to click the plus sign on the Management Asthma folder. With the folder expanded, you can select Asthma Spirometry by clicking the box to the right of the name. Once the recommendation is selected, the default frequency displays in the scratch pad area of the window. Clicking on either the displayed due date or frequency will allow you to change the settings if needed. Clicking the Reason drop-down button will allow you to assign a reason for why you are adding this recommendation to the patient's chart. For example, patient risk factors. Once the reason is selected, you can enter an additional comment or click the OK button. You are returned to the Recommendations window, and the newly added recommendation displays for you to satisfy. This concludes the tutorial, Adding a Recommendation. Please refer to the tutorials on updating and managing recommendations for instructions on working with a recommendation.